Hi, good afternoon. Welcome to Thursday Reading Live. This is me, Vandana PS, joining you from Neethu's Academy. So, how fast these days are going, right? Yes. Okay, so as usual, we have a new material here, a sample question from part B. So, I'll give you 2 minutes for the completion of this particular question, then we will move on to the answer. Okay, so here comes the question. All right, so welcome back. So, have you all done the question? Okay. Hi, Kavita, Reba, good afternoon. Okay, so B, good afternoon. Okay, so this is a guideline. Okay, so first of all, the first step, just read the question. So, what is the question? The guidelines for infection control require dentists to. Okay, then second step. So, what are the keywords from the question? So, what are the keywords? May I know in the comment, what are the keywords from the question? The guidelines for infection control require dentists too. So, what are the keywords? Okay. Yes, Kartika, Archana. Hi guys, good afternoon. So, let me know in the comments please, what are your keywords from the question? Guidelines for infection control require dentists too. So, my personal keywords, okay, I'm just underlining infection control, then dentist. So these three are my keywords from the question. Okay, so as I already mentioned, these are guidelines. So what are guidelines? Suppose I'm asking you, what are guidelines? Any answers? Okay, so what are guidelines? So guideline, which means a set of rules and regulations that someone has to follow. Okay, which means set of regulations or principles, instructions. Okay, so that we have to follow it. It is compulsory. So which comes under this particular question, which comes under the first category, that is, those are guidelines, and what are you reading for in a guideline? So guidelines which contain a set of rules and regulations, as I already informed. So which means we are reading for the details. Okay, the details. Then which line is or which sentence is important in a guideline? So I can always say the first sentence is important. I'm not saying that first sentence is the answer, but still that first sentence will give you a clue towards your answer maybe. Okay, so first sentence is important. I will say first sentence is important in a guideline. So what are guidelines? Which means a set of rules and regulations that someone has to follow. And what are you reading for in a guideline? We are reading for the details. Okay, and which sentence is important in a guideline? I will say first sentence is important. I hope it is clear, right? Okay. Okay, Anita. Yes, Anu. Good afternoon. Yes. Okay, Kavita, infection control dentist. So yeah, same like my keywords. Okay, Kartika, infection require dentist. Very good. Okay, Kavita, instructions. Fine. So those are we are reading for instructions. Okay. Then option A. So either you can read the options first or you can directly move to the paragraph first. Okay, it's up to you. So I'm just reading the options first, then I'll move to the paragraph. So option A, strictly abide by the rules set out within the document. So my keywords from option A are strictly, then abide, okay, document. So these are my keywords from option A. And what about option B? Use their own judgment when putting the strategies into practice. Okay, so my keywords, judgment, then strategies, practice. As well from option C, follow the example of well-established dental clinics. So my keywords, follow, then example, then clinics. Okay, so these are my keywords from option A, B and C. Okay, so what is your answer? Let me know in the comments what is your answer for this first question. Any idea? Okay, so now I'm moving to this particular extract, guidelines for infection control for dental practitioners. Okay, the routine work practices outlined here are designed to reduce the number of infectious agents in the dental practice environment, prevent or reduce the likelihood of transmission of these infectious agents from one person to item or an item location to another, and make items and areas as free as possible from infectious agents. Okay, so this is a very lengthier sentence, and from the first sentence I would like to connect my option towards option A. Okay, because they are talking about a particular what designed to reduce number of infectious agents. So they outlined some designs here, some instructions here. So that I just connected to option A, strictly abide by the rules set out within the document. Maybe I have no idea. Then it is important to acknowledge, understand that professional discernment is essential in determining the application of these guidelines to the situation of the individual dental practice environment. Individual dental practices must have their own infection control procedures in place which are tailored to their particularly daily routines. Professional awareness is critical when applying these guidelines. Okay, application of these guidelines to the particular circumstances of each individual dental practice. Each dental practitioner is responsible for implementing these guidelines in their clinical practice and for ensuring their clinical support staff are familiar with and able to apply them. So it's all about this particular document which contains the guidelines. So they are reminding, for example, I can say, yeah, they are reminding to follow everything correctly. So option A, strictly abide. Abide, which means follow, adhere, okay, by the rules set out within the document. So rules, which means principles, okay, within the document. So yeah, this is the document which contains the guideline. And option B, use their own judgment when putting strategies into practice. That is contradictory or opposite option. Why it is contradictory? Because they can't use their own judgment. They are not using their own judgment here. Who? This dentist. Okay, they are following these guidelines, these rules. So it is contradictory option, or I can say opposite option. They are not following their own judgment. They are following the guidelines, the document. Okay. And what about option C? Follow the example of well-established dental clinics. I am eliminating very easily because it is not mentioned anywhere in the paragraph. They have to follow the example. Okay, so whether you like it or not, my answer is option A. strictly abide. So those are guidelines, we have to follow it, right? The rules set out within the document, and that is the correct answer. Clear? Any doubts in that? Okay, so Anu? Yes. So you're the first one who commented the correct answer, which is option A. Very good, dear. Okay, that is option A. So that is all about this particular question. So now let's discuss about part B in detail. Okay, so what is part B, or why we are doing part B in detail? So because in part B, we have 6 questions, total 6 questions, and the 6 questions will be in the form of multiple choice questions with 3 answer options. Okay, so either you can read the question, then the options and the paragraph, or else the second one, you can read the question, read the paragraph, and you can come back to the options. So what strategy we are using here? Okay, so we are using the strategy that's called elimination method or elimination strategy. So we have possibilities of answers here. Maybe first one, maybe the correct answer. Okay, one option will be the correct answer, and we have other 2 options. So one option will be not mentioned anywhere, and one option will be contradictory, or I can say opposite option. And it can vary according to the different type of questions. Okay, so that's all about that. And in part B, we have different categories of questions, category 1, 2 and 3. So I just informed you regarding the first category, guidelines. Okay, I hope it is clear. Hi Jino, good afternoon dear. Yes, okay. And while dealing with this live session, I've seen a lot of fraudulent messages. Maybe these fraudulent people will, okay, definitely they will contact you, but we Neethu's Academy will not send you any messages personally. So please be careful about that. Please report them and just block them. Okay, so that's it. Yeah, so now we are moving to the important part, a different topic today. Okay. Yes, non-gonococcal urethritis. So that is the topic today. Okay. Yes, so what about part A? Okay, so each and every live sessions is a kind of, revision. Okay, so anyone attending my class for the first time? Any student? I think no, right? Okay. So yes, what do you guys know about part A? Hi Reba, good afternoon dear. Okay, so did you do the material? Part A, this new topic? Yes, Neethu, Nobi, good afternoon. Okay. So yes, tell me, what about part A? Okay, so we have 20 questions as you can see here, 1 to 20 questions, and 1 to 7 questions that can be categorized, 3 categories of questions. So 1 to 7 that can be categorized into match the following questions, and 8 to 14 those are short answer questions, and the last one 15 to 20 which are fill in the blanks, right? Yeah. Okay. Then so today I'm gonna read these 4 texts, and let's find out what are the keywords from the texts. Okay, so we have a 13 keyword strategy. All right, so what are the 13 keyword strategy that we are following? Any idea? Let me know in the comments what are the 13 keyword strategy that you guys are following. Okay, Reba? Yes, Reba, Rijo, and yes, do you know about that? The 13 keyword strategy which we are following here. Okay, so from the live sessions, you guys now know what are the 13 important keywords that you have to mark while reading A, B, C, and D. Any idea? Okay. Okay, Reba, 1 to 7 match the following, 8 to 14 short answer questions, and 15 to 20 fill in the blanks. Very good, dear. Okay, you have a clear picture regarding the set of, the pattern of questions. Very good. Okay, so 20 questions, 15 minutes, 1 to 7 match the following, 8 to 14 short answers, and 15 to 20 fill in the blanks. Very good. Okay, so B, only 2, heading and subheading. What about the rest? I need the 13 keywords. Is it possible for you to comment the 13 keywords here? Okay, so the first one, okay, signs and symptoms, then, okay, 4. So heading, subheading, signs and symptoms, right? Okay. Okay, brackets, then what else? Heading, subheading, signs and symptoms, brackets, anything else? Okay, so what are the 13 keyword strategy? Yes, so when you read each and every text, we can mark certain important words from each of the text. Okay, so first of all, headings. If headings mentioned, we can mark all the headings. Second one, subheadings. Okay, all the subheadings. Third one, all the numbers. Okay, all the numbers, let's mark all the numbers. And the fourth one, all the names. Okay, all the names. I'm not repeating what are names. You guys know what are names, right? So all the names. Then fifth one, what is fifth one? Yes, heading, subheading, numbers, signs and symbols, not symptoms, okay? Symbols, signs and symbols, then names, all the names. Okay, then sixth one, all the abbreviations, okay, which means short forms. As you can see here in text A, I'm just giving you an example. So NGU is an abbreviation, STI another abbreviation, AMAB, yeah, so abbreviations mentioned. So that those are short forms, okay? So sixth one, all the short forms. Seventh one, yeah, what is seventh one? Brackets. Okay, brackets are really important, so brackets. Then eighth one, what is eighth one? All the italicized and bold words. Okay, ninth one, the words indicate time. Then the 10th one, the words which can be related with experiment related words. Then 11th one, all the words that can be connected with research related words. Then the first and last line of each and every paragraphs, as well as all the bullet points. Okay, so these 13 keywords you have to mark when you read text A, B, C and D. Okay, so a lot of comments. Yeah, let me check. Okay, Riba, heading, subheading, numbers, signs and symbols, names, abbreviations, brackets, italicized words, bold letters. Okay, words indicate research. Yes, very good, dear. Okay, Neethu, headlines, subheading, numbers, abbreviations, names. Okay, Shasina, numbers. Yes, Anasuya, hi dear, good afternoon. Okay, Sujita, numbers. Okay, Manoj, names such as person, equipment. Okay, which means you can mark all the names. For example, name of a person, name of a disease condition, name of an equipment. Okay, name of a country. So that is what I called all the names. Yeah. Okay, Lina, name. Okay, Sujita, it's abbreviation here. Okay, it's abbreviations, which means short forms here. Okay, so B, words indicate research, time, experiment, new terminology. Yeah, of course, you can mark new terminology, but I won't suggest you to mark the new terminology because you will get confused. Okay, you will stuck into that. Okay, so I won't suggest new terminologies, but still, if you want, you can mark, of course. Okay, Manoj, yes, all of the abbreviations. Okay, Lina, abbreviations. Words indicate timing, words indicate time. Okay, Riba, heading, subheading, signs and symbols, all names, bracket, abbreviations. Words indicate time, experiment, research, italicized and bold letters, all the bullet points. Very good, excellent. Okay, Sujita, signs and symbols, brackets, capital letters, which means, okay, Laisama, actually not capital letters, dear. What can I say? The names. Okay, not capital, bold letters you can mark, as well as italicized words you can mark, not capital letters. Okay. Yes, Jobins, hi. Okay, so that's all about that 13 keyword strategy. So now you guys can read along with me. Then we will underline the keywords from each of the text. Okay. So, non-gonococcal urethritis, or NGU, is inflammation of the small tube that allows urine to exit your body, or urethra. It's commonly a sexually transmitted infection, STI, that occurs after having unprotected sexual intercourse with a partner who has an NGU infection. But there are also non-sexual cases. It can affect anyone, but men and people assigned male at birth, that is AMAB, are more likely to have NGU. So non-gonococcal means that germs other than gonorrhea cause the infection. Urethritis means an inflammation of the urethra. Another name for non-gonococcal urethritis is non-specific urethritis, or NSU. Non-gonococcal urethritis is very common. Healthcare providers treat non-gonococcal urethritis more than any other STI in men and people, AMAB. Urethritis feels uncomfortable. You may have a burning or stinging feeling when you pee or ejaculate. You may also feel annoying itch inside your urethra that you can't scratch. Okay, so that is all about what is this particular disease condition. Okay, that is what I understood. Text A is all about what is non-gonococcal urethritis. Okay, yes, and about the prevalence. Okay, how common it is. Then now we are moving to text B. So may I know in the comments what are your keywords? Is that your keywords from text A, like what I've marked here? Okay. And before that, let me tell you something. I'm so happy that a lot of students are commenting, okay? Because I know personally that you want to change, right? Okay, because you guys are commenting everything. You guys are watching my live sessions because you want to change. Okay, if you want to change, learn. So this is the only method we can learn something, okay? Yeah, so coming back to text B. Yes, so what are the keywords from text B? I'm just marking the heading, symptoms. In men and people AMAB, early symptoms include, so I'm marking the word early, which indicates time, okay? Leaking fluid or discharge from your penis, pain while peeing or dysuria, pain while ejaculating, dysorgasmia or orgasmalgia, okay? So these are different quite names, yeah. Then itching, irritation and or tenderness, abnormal pain, signs of infection that affect other parts of your body, including fever, chills, headache, and feeling very tired, okay, fatigue. Without treatment, the infection can get worse. More severe NGO symptoms in men and people, AMAB, may include testicular pain and swelling, infertility. Then women and people assigned female at birth, AFAB, usually have fewer NGO symptoms, but symptoms may include vaginal discharge, pain while peeing, pain during sexual intercourse, as well as spotting or cramping throughout the month, okay, irregular periods. Okay, then if you get NGO from the bacteria, symptoms usually develop, usually it's a word that indicates time, develop 1 to 3 weeks after infection, but you can also have NGO without any noticeable symptoms. So these are my keywords from text B. Okay, so sorry for that. Yeah, so these are my keywords from text B. Yes. Okay. Okay, Reshma, Sajiv, Riya, Liju, Kopika, Susmin, good afternoon. Okay. Yes. Anasuya, your symptoms. Okay. Symptoms AMAB, discharge, dysuria, dysorgasmia, fatigue. Very good, dear. So those are your keywords from text B. Of course, very good. And also you can mark the words that indicate time, okay? For example, I'll say, early, okay? As well as usually from the last line also, after. Okay, so these are the words that indicate time. Okay, so now text C, evaluation. Okay, so urethritis can be diagnosed with any of the following: mucoid, mucopurulent or purulent discharge on examination, then gram stain of urethral secretions demonstrating equal to white blood cells WBC per oil immersion field, then positive leukocytes, then esterase tests on urine analysis, or microscopic examination of sediment from spun first void urine demonstrating equal to 10 WBC per high power field. Then the diagnosis of NGU requires the exclusion of gonorrheal infection. This can be achieved with a gram stain that lacks gram-negative diplococci or by any negative Goria tests. Okay, then as well as the bracket also, I'm just underlining. In men at high risk for infection, if symptoms are present but none of these criteria are met, presumptive diagnosis can be made and empiric treatment started. Patients should also have nucleic acid amplification test or NAAT performed for chlamydia, gonorrhea and trichomoniasis. In urethritis, NAT testing is recommended over culture because of its high sensitivity and specificity. Then NAT testing for M. genitalium exists but is not widely available. And text D, it's all about the treatment, okay? Lot of treatment measures mentioned, type of infection, so everything is important, okay? Yeah. Something has happened in between. Yeah, it's all about treatment, infections, this measurement of the medicine mentioned, as well as duration of the therapy. Okay, I'm just marking all the numbers. Okay, so 250, 320, then 2 grams, 1 gram, 400 mg, 100 mg, 200, 250 mg. Okay, so all the numbers, just marking all the numbers because I know that it shows all the regimen, okay, the routine. So yeah, 7 days, then more than or equal to 7 days, the medication can be given 10 to 14 days, 4 weeks. Okay, so that's all about a random check in text D. Okay, so now we are moving to the first question. Okay, yes, Alfie, Soumya, hi guys. Okay, so what about the first question? Okay, so let me know in the comment what is your answer. Okay, first one, what does the subject of the disease personify? So subject here means what I can say, subject, which means the title, okay, the name. Okay, so what does the subject of this the disease personify, which means indicate. Okay, so what is your answer for the first question? Any idea? What does the subject of the disease personify? First question. Let me know in the comments what is your answer for the first question. Okay, Reshma. Yes, Sobi. Very good, Anasuya. Subject, disease, personify, text A. Okay, so, okay, Riba, Neethu, Kartika, Alfie, Riya, Kavita, Raki, Susmin, Neethu, okay, Ramya, Anita, Sujita, Gopika. It is from text A. Very good, excellent. Okay, subject, once again I'm saying subject, which means it's not the topic which they have dealt with here, it's the title, the name. Okay, so that is from text A. And already I've told you, text A is all about what is this particular infection. So that explanation is mentioned in what is non-gonococcal urethritis, which is in text A. Okay, so we get that answer from text A. Very good. Okay. Yeah, okay. Okay, Anita. Yes, Gopika, Vaishnavi, Divya, Anu, Riba, Soumya, Amrita, Jinu, Manoj. Okay, Reshma. Yes. Hi, Reshma. Okay, so that is from text A. Second question, which are the disparate ways of gouging non-gonococcal urethritis? So my keywords, disparate, gouging, which means what? Measuring, identifying. Okay, disparate, which means different. So different ways of evaluating, analysis, that is gouging, I can say. Okay, gouging non-gonococcal urethritis. Any idea? Second question. Second one. So why does text C? Yeah, where is it mentioned in text C? This gouging, different disparate ways. Okay, Reshma. Yes, Reshma, Sajeev, Sobi, Susmin, Rakhi, Neethu, Kartika, Ramya, Riba, Jinu. Yes, it is from text C. Okay, Gopika, C. Okay, Riya, it is from text C. Very good, excellent. So as you can see here, text C, it's all about evaluation, which means you can gauge, okay, gouging, evaluating, okay, and G-A-U-G-E, gauge, which means another meaning measure, okay, measuring something, measurement. So evaluation, which means here, that is analysis, that is, gauge. Then it is from text C. Then third one, how long should we continue the treatment for gonococcal meningitis? How long? They are asking you regarding the duration, right? So how long should we continue? So my keywords, how long, continue, treatment. So what about the treatment options? Okay, we don't need answers here, but still we need that particular text, right? So yeah, treatment. Okay. Yes, Reshma, Sajeev, Reba. Okay, Kavita, Gopika, Anasuya, Neethu, Sobi, Susmin, Rakhi, Jinu, Kartika, Ramya. Yes, Riya, Sujita, Vaishnavi. Okay, that is from text D. Very good. Treatment options mentioned about this particular condition, which is in text D. Treatment regimes for gonococcal infections. Okay, as well as duration of the therapy, that is how long. Okay, so that is it. So fourth one. Yes. So what about the fourth question? What implication of NAT testing? What is the implication? Okay, so my keywords, implication, NAT, N-A-A-T, NAT testing. What about fourth one? Implication of this particular testing. So already we have marked all the abbreviations, so it is easy for us to identify these answers. Yes, so that is from text C, the last para. Okay, the importance, implications. So answer is C. Very good. Okay, Jinju. Okay, Susmin. Okay, Riba. Yes, Ramya. Neethu. Riya, Raki, Anita. Yes, Riba, Kartika, Neethu, Jinu, Sujita, Anu, Saumya. Yes, it is from text C. Already we have found out that correct answer, right? Okay. Then fifth one. The maximum time required by the bacteria to present symptoms post to infection. So maximum time required. So maximum required symptoms. So what about fifth question? Symptoms. So my only keyword is symptoms. Okay, so what about fifth one? Yes, symptoms, as you can see here, which is mentioned in text B, symptoms, right? So all the symptoms would refer to this particular disease condition that is in text B, both in men as well as in women. Okay, so that is from text B, fifth question, text B. Okay, so if you know the answers, please do comment, because I can, if it is wrong, I can correct you. Okay, a lot of answers. Yes, Jinju, Alfie. Yeah, it is correct, Neethu. Reshma, Sujita, Saumya, Ansuya, Sankita, Anu, Thomas, it is from B. Very good. Sixth one, those typical, which I can say common. Okay, common drugs used to manage gonococcal arthritis. So typical, then drugs, medicines, manage. So what are the medicines we are using to treat the condition? So treatment or this medications mentioned in, okay, so which is from text D, a lot of medicines mentioned. Okay, so what are the medicines mentioned? See, a lot of medicines mentioned. Okay, so that is from all right, so that is from text D. Yeah. Okay, Gopika, your answer is correct. Saumya, Neethu, Ramya. Okay, Kartika, yes, text D. Okay, Jinu, text D. Sujita, Sankita, Saumya, yes, Rini. Okay, Anu, it is from text D. All the medications mentioned in text D. Very good. Okay, seventh one. Which are the initial signs of non-gonococcal urethritis in men? Okay, initial signs, symptoms. So what about signs and symptoms? Yes, you don't have to check about. So answer is from text B, signs and symptoms, right? Okay, yes. Okay, Vaishnavi, very good. Text B. Okay, Neethu, Nopi. Okay, Reshma, it is text B. Kartika, yes, Sobi, text B is the correct answer. Okay, so this is all about 1 to 7 set of questions. So now we are moving to the short answer question. Okay, so the important instruction, once again, short phrase, maximum 3 words. Okay, the consideration of which bacteria is not extensively done through NAT testing. Okay, so my keywords, consideration, bacteria, not extensively. Okay, so NAT testing, it is mentioned in text C, right? Okay, a lot of correct answers. Okay, Vaishnavi, you got 7 out of 7. Yes, Reba, Rijo, 7 out of 7. Divya, Subhash, Anu, Thomas, Neethu, okay, 7 out of 7. Very good, very good. Okay, Jinu, 7 out of 7. Excellent. Okay, so 8th one, yes. What about 8th one? NAT testing. It is all about M. genitalium, right? That is the correct answer. Okay, very good. Okay, a lot of correct answers. Yes, your answer is correct. Okay, M. genitalium, it is the correct answer. Then 9th one, how long, which means they need the duration, should we have to administer drugs to manage endocarditis? So my keywords, how long, manage endocarditis. Okay, so how long, what is the duration? So medications mentioned in text D. So endocarditis, which is in the last line, yeah. So what about this duration of this medicine? Okay, so that is 4 weeks. Okay, so 4 weeks. So you can write it as whatever they have mentioned here. Okay, that is, you can write as 4WK dot. Okay, so this is short form for weeks. So 4WK, or you can write 4 weeks. Okay. Then 10th one. What is the alternative title of non-gonococcal urethritis? Okay, so what is another name? Alternative name? Yeah, a lot of correct answers. Yes, it is 4 weeks. Very good, Anita, Kartika. Yes. Okay, Reshma. Yeah, what about 10th one? Any idea? 10th question. Okay, because already this abbreviation is mentioned there in the paragraph, so you guys can write abbreviation, right? Okay. Yes, either the abbreviation or the full form. Non-specific urethritis. NSU. Okay. Then 11th one. Okay, NSU. Okay, Reshma. Yes, Rini. Okay, non-specific urethritis. Okay, dear. Okay. Okay. Yes, Anita, non-specific urethritis. Okay, Gopika. Yes. So either you can write NSU or you can write the full form. Both are correct. Yes. 11th one. The eviction of which condition is necessary to conduct the diagnosis of NCU? So my keywords: eviction, condition, diagnosis. Okay. So what about the diagnosis, evaluation? And NGU, so which is, I think it is mentioned in text C. Okay, the diagnosis, evaluation of the condition. Any idea what is the correct answer here? Gonorrheal infection is the answer. Very good. Yes. Okay, so I'm happy that you guys are getting the correct answer here. Okay, okay, Sankita, Kavita, yes. Okay, Rini, Sobi, Jinju, Susmin, Anita, Reba, Raki, Reshma, Anasuya, Neethu, Anu, yes, Vaishnavi. Okay, okay, Reshma, it is gonorrheal infection. Okay, so that is the correct answer. Very good, very good. Okay, then 12th one. The duration of, so I haven't seen that answer, right? It is from text C. 1 second, I'll show you the answer. Okay, it is gonorrheal infection. The diagnosis of NGU requires the exclusion, that is what? Eviction of gonorrheal infection, and that is the correct answer. Okay. Then 12th one. The duration required by, again they need the duration required by the bacteria to onset the symptoms in people ensuing which means following the infection. So what about the duration? How long it will take? Okay, so what about the duration? It will take about the infection. Okay, so yeah, it's not in text D, that is from text B. Okay, so how long it will take? Not 3 weeks, 1 to 3 weeks. Okay, so answer should be 1 to 3 weeks. Yeah. Okay, either you can write 1 to 3 weeks like this, or you can write directly like this one, 1 to 3 weeks. Okay, both are correct. 1 to 3 weeks, or like numbers 1 to 3 weeks. Then 13th one. The inflammation of urethra is called dash. So what is it called? Okay, 1 to 3 weeks. 1 to 3 weeks. Oh, yes, Reba. Okay. Okay, Jinju, 1 to 3 weeks. Okay, Sankita. Okay, I always suggest you to write, whatever they have mentioned in the paragraph, you can write it there in the answer option. Okay. So whatever it is mentioned there, what is mentioned here, it is in words, right? 1 to 3 weeks. Okay, I will suggest you to write whatever they have mentioned in the paragraph. Okay. Yeah. 13th one. Okay, 13th one. Answer is urethritis from text A. Very easy. Okay, so answer should be urethritis. So urethritis means inflammation of your urethra. So answer is urethritis. Okay, very easy question. Then the last one. How much mg? So they need that number. How much mg of ceftriaxone is necessitated to treat uncomplicated gonococcal infection of pharynx? Okay, ceftriaxone. Okay, that is the name of the medicine here. How much mg? So that regimen or this routine, that measurement which is mentioned here in text D. So what about the medicine? Okay, so medicine which is 250 mg. Okay, so medicine that is 250 mg recommended. So answer is 250 mg. Okay, correct answers, yes. Okay, Sankita, Biju. Okay, Jinju, Reba, Anita, Nimisha, Vaishnavi, Anu, Reba, 250. Okay, so answer should be 250. Okay, is that 250 or 250 mg? If it is 250 mg, how? Or if it is 250, why? Why it is 250? Again, confused, right? So, is it 250 mg or 250? Okay, Sangeeta, mg is mentioned in the question, so you don't have to repeat it, right? Okay, so what about others? Is that 250 or 250 mg? Mg is given, so not required. Okay. Mg is already mentioned, so okay, mg is already mentioned in the question, so you don't have to repeat it, right? Mg is mentioned, okay, mg is given in the question, okay. So answer is 250. Okay, 250 is the correct answer. But, okay, I'll give you another example. If the question is asking you, what percentage, okay, what percentage of population, maybe that is the question. Okay, and answer is mentioned in the paragraph it as, the population is 26%. Then what will be your answer? They have mentioned what percentage of population, that is the question. And in the paragraph they have mentioned 26% of population. Okay, then what will be your answer? Question is what percentage? So your answer should be, either 26 or 26%. Yeah, let me know in the comments. Okay, Sujita, 26, Kartika, 26%, okay, Reshma, 26%. It's not 28, okay, 26, okay, 26%, okay, and Suya, 26%, Rini, 26%. Okay, yes, it should be 26%. That percentage symbol should be there. Okay, with names and percentages, you can repeat even if it is mentioned in the question. I hope it is clear. Okay, you can repeat the names. If it is mentioned in the question, you can repeat names. Percentage is mentioned in the question, you can repeat that percentage symbol into your answer option. So answer should be 26%. This should be the correct answer. Okay, so now then the last set of question. 15th one. A dash can be made if men at high risk for infection are presented with symptoms but none of these criteria are met. Okay, a dash can be made. What can be made? A dash can be made. What can be made? Okay, so what can be made? Any idea? Okay, Reshma. Presumptive diagnosis can be made. Very good. Which text? Any idea? Which text? Yes, Kavita. Yes, Susmin, presumptive diagnosis. Okay, Riba, Rakhi, Gopika, Anasuya, Vaishnavi, presumptive diagnosis. Okay, Rini. Okay, Sangeeta, it is presumptive diagnosis. Yes, where is it mentioned? So, which is mentioned in text C, right? Okay, so in men at high risk for infection, if symptoms are present, but none of these bacteria are met, a presumptive diagnosis can be made and empiric treatment started. Okay, so answer is presumptive diagnosis. Okay, very good. 16th one. Other than testicular pain and swelling, the severe symptom present in men and people AMAB is dash. So what is it? Okay, other than swelling, I think it is comes under the symptoms. Okay, yeah, here comes testicular pain and swelling. So after that, infertility. Yes. Okay, infertility should be the answer. Okay. Then 17. In urethritis, dash is recommended over culture because of its high sensitivity and specificity. Yeah. What about 17th one? Dash. In urethritis, dash is recommended. What is recommended? Okay. See? What is recommended? In urethritis, NAT testing. NAAT. Yes. So, NAT testing is recommended. Very good. Okay. 18th one. Dash means that germs other than gonorrhea cause infection, whereas urethritis means inflammation of your urethra. Dash means that. What means that? What means that? Okay, any idea? 18th one. Okay, Reba, NAT testing. Yes, Ramya. Okay, so 18th one, non-gonococcal. Very good. Okay, so there is no space between non and gonococcal. It should be single. Together. Okay, non-gonococcal is a single term, not separate term. Okay, so non-gonococcal is the correct answer. Means that germs other than gonorrhea cause infection. Okay, so answer is non-gonococcal. Very good. And 19th one. Yes. Okay, Sangeeta. Yes, so B. Non-gonococcal. Very good. Okay, Kartika, Ramya. Okay, Vaishnavi, Reepa. What about 19th one? NGO is commonly a dash that occurs after having unprotected sexual intercourse with a partner who has an NGO infection. So what is the answer here? Okay, 19th one. STI. Very good. Which is mentioned in text A. Answer is, it is a commonly sexually transmitted infection, which means STI. Very good. STI. Okay. Okay, Sangeeta. Okay, Anu, Kavita, yes, Ramya. Okay, very good. It is STI or sexual transmitted disease. It's not sexual transmitted, sexually transmitted. Okay. Yes. Okay, Jinju, clear? Okay, so the last one, 20. It is recommended that in order to treat meningitis, we need to continue the course of the dose for dash days. How much days? Okay, 10 to 14. Very good. That is from text D. Okay, 10 to 14 days. It's all about meningitis. That is 10 to 14. Okay, very good. Any doubts? Any of the questions? So, anyone with 20 out of 20? I'm eagerly waiting to know that. Okay, 20 out of 20. Anyone with 20 out of 20? Okay. Okay, 10 to 14 days. Okay, Anasuya, 19 out of 20. Pretty good. Okay, Kavita, 20 out of 20. Excellent. Okay, Reshma, 20 out of 20. Okay, Reba, 20 out of 20. Okay, Ragi, 19. It's okay, dear. Next time, 20 out of 20. Okay, Reshma, 20 out of 20. Okay, Jinju, 18. Sangeeta, 20. Vaishnavi, what about you? Okay, Sobi, 20 out of 20. Happy? Okay. Yeah, okay, Anita, 18. Okay. So, thanks. Okay, so, until next time, God bless you all. Thank you.